Cool.
One
I
person.
bet it's coming out, baby.
Oh.
You're right.
Please do. Please. Better. Are we back?
Are we back?
Oh.
Okay.
I can't see you. Come here. Come on, James.
I just went back on
Guys,
my
are we back?
data.
Can you see us?
Can you hear us properly?
So this. You look Guys, could
Hi.
you put like a
Thumbs
smiley
up
face or a thumbs up
something.
to say all good?
No?
No. Yes, maybe.
C'est comme ça. What do you think?
Anyone?
Hello.
There is 3 people in.
Okay.
There?
Yeah,
I need to behave then.
3 people in. Smiley faces.
Oh.
I think we should be okay.
We can. So we're good.
And yeah, we're
We're
good.
good?
We're good.
Shall we start, guys?
Yeah, you should get
As
started
we're
now.
overdue. Okay, so hi guys. Thank you for joining us today. This is the first TikTok live that we're going to do for Mental Health Week, and we're going to start off today by talking about sleep and mental health. I'm joined by lovely people around me. Can everyone introduce themselves?
Hi, I'm Dr. Khaled. I'm one of the GPs.
Ladies first, James.
Hi, I'm Amy. I'm one of the care navigators.
Hi, my name is Sam. I'm one of the clinical pharmacists here.
Oh, come join us.
Come.
Come on.
Cool, and then I'm Marvin, junior content creator with HiOS.
Okay, so thanks for joining us. So today we're going to be talking about sleep and mental health. Now, sleep itself, so oversleeping, undersleeping, trouble with sleeping itself is an issue, but it can also be associated with mental health issues such as anxiety or depression, which is why it's so important that if you are experiencing mental health issues and it's affecting your sleep, to speak to your GP practice and we can help you sort of manage that so that you can obviously improve your sleep. Now, just coming very quickly to Dr. Khaled first, as a GP, what do you usually hear from patients about sleep and mental health issues?
Well, the common presentation people with mental health issue that come with, associated with sleep disorder is either insomnia or sleeping too much. Also, they have like a very fluctuate or irregular sleep pattern. They would only get maybe 3 or 4 hours of sleep, not able to sleep. And these are the common presentation that we usually see in the setting.
And Dr. Khaled, what do you usually advise patients like this?
I think the most important thing is addressing what is causing the symptoms or what is causing the sleep disorder. If it is anxiety related, then we try to address what is causing what is the root cause or what are the trigger factors. So I think finding out what is the main reason of having the sleep deprivation or sleep disorder is important. After that, of course, depends on what they would like to do. Is it depending on if they have tried anything? Is it something they would like us to specifically focus on? There is things that are available, such as we talk about sleep hygiene, having a routine, making sure that you're sleeping on time. Exercising is another something that might help with the sleep. It becomes a bit difficult. People with who've got shift pattern, I think that becomes a bit more challenging to address, because then for them sleep, even if they have tried sleep hygiene or they cannot adapt to a particular sleep pattern. So that becomes a bit more tricky. Patients who would like, of course there are treatment options available over the counter they can address. More in terms of there are therapies, there is we can look into such as CBT, and that might be helpful. So I think it all depends on what the patient is presenting with, and also it's very important to see what they are looking, or what kind of management they would like us to offer, and if we can actually incorporate with their daily routine as such.
Thanks, Dr. Khaled. So it sounds like there's a lot of things out there that can help you improve your sleep. Just a question out there for everyone with me today. So what do you think, guys, keeps people up at night or affects their sleep? Just
I think
shout out.
stress is one, for sure.
Why? How do you think that affects sleep?
Well, if you've got things like your mind's constantly racing, I don't think like you'd be able to sleep well. Like you really need to like kind of have like a calm mind, and so if you constantly got thoughts in your head, things you're worrying about and stuff, that would definitely keep someone up at night for sure. When I was going through uni, like it was stressing me out quite a bit, so like I would have a bad sleep pattern because I would like to play games after uni, and that was what helped me forget. And so I would prolong my gaming hours till like 2 a.m, 3 a.m, because it helped me forget. But then I'd have to get to bed. So yeah, stress is for me personally. Stress was one that kept me up quite late at night.
I agree with that. I mean, I think stress can play a major role, and it could be like exam stress or stress. It could be personal, stress. It could be financial, work-related.
Lots of different kinds of stresses.
Definitely.
I think a lot of people do actually have a lot of family stress that they fail to actually acknowledge or understand or talk to people about, and I think that's predominantly what keeps people awake at night. I can speak for myself. When I used to have family problems, it used to keep me awake for multiple hours. I never used to sleep, used to be awake till about 5 o'clock in the morning. But it's that extra sort of step to ask for help and to talk to people which will actually get you on the right path.
Thanks for sharing.
By the way, if anyone has any questions, put them in the comments. We're definitely looking at the comments, so if you have anything you want to ask anyone, just put it in there and we'll get to it.
Please do. Any other sort of experiences with sleeping issues? Anyone here?
I think, another, it's kind of a catalyst, but when you have problems sleeping, you end up on your phone, and then you're on your phone for so many hours at night time, and it's like 6 o'clock and you have to work the next day. I find that so,
I feel like we lose focus of how many hours we're on our
yeah,
phones.
definitely.
So I know with Instagram you can log off, or there's certain time frames you can stay on Instagram. I think that's really good, because we tend to lose focus when we're on social media.
Yeah, and then it becomes a cycle, isn't it? For example, you can't sleep, you go on your phone, and then you worry about the time, and then you say, oh, my alarm's going to go off in 1 hour or 2 hours, you can't sleep. It's like a vicious cycle, never ends. Going on from that point, Sam, our clinical pharmacist next to me, there's not only prescribed medication, is there? There's stuff that you can get over the counter in the pharmacy that you can try to help with sleep?
Yeah, absolutely. So I think the first point of protocol would always be try to go to your community pharmacy to see what sort of over-the-counter remedies that you can get. So the majority of these are sort of natural herb-based sort of remedies. So they are things such as valerian, which is a root extract which can help in terms of reducing stress, helps with anxiety as well, and sleep. So that's an option for patients. There's also different types of antihistamines that can cause slight drowsiness, which can help with sleep. Now, in terms of these medications, we only really recommend these to be used for short-term use for about a week or two to help break a cycle. Any sort of further treatment or if you need more of it, then we'd suggest you speak to a GP. But there are sort of herbal remedies that you should be trying first. I think, speaking from my own experience, lavender oil is really, really good. So putting a few drops of that on your pillow can actually help in terms of sleep. And I think as well, in terms of talking about your pillows, it's really important for sleep hygiene to make sure you have adequately plumped pillows. Having poor pillows can actually lead to poor sleep as well. So those are a few options.
Someone said, do you recommend sleeping pills? Linked to the...
I mean, for short-term use, if your sort of sleeping patterns are really bad, we would actually assess you on a sort of need basis, on an individual basis, to see if you need sort of a short-term relief for, let's say, insomnia. But it's not something we'd recommend on a regular basis for patients.
I agree. I mean, with Sam, in terms of the sleeping pills, that would be not the first line of treatment, if you can see. So we would encourage to try other things first. And again, depending on the severity and each individual varies, so depending on what they have tried and what has or has not worked for them, then we can talk about sleeping pills, but that is not something that we recommend as the first line of treatment.
A comment also has come in saying, how do you deal with a bladder that keeps you up at night?
question, I think reduce caffeine in the evening, because that can make you want to pass urine more often.
Try not to drink maybe an hour before you go to bed.
Yeah, I mean, we always encourage our patients to drink at least 8 glasses of water in a day, but obviously try to minimize that towards the end of your day when you're about to sleep. I mean, if it becomes a sort of issue where even if you're limiting the amount of liquids you're having before bedtime, I think that's something you need to speak to a GP about.
Cool. And we have another comment saying, how do you deal with night terrors physically waking you up?
I think that's something that we need to discuss. If that's something that is becoming, it's been going on for a while, and if that's something not being addressed, then definitely I think we need to look into it, and you need to speak to your GP or a clinician who can, explore a bit more about what's, any underlying issues. And so I would advise go and speak to your GP for that.
Cool. Those are the comments I see. Something I wanted to ask. So when you are dealing with someone that has like sleep issues, would you look to like find the root cause of what's keeping them up at night, or would you just try like simple things to start with? Like what is the process like?
So I think I mean, like we talked just about, the most important thing is finding out what is causing the sleep deprivation or sleep disorder, or what is causing you to sleep a bit too much, or So is it something that has just happened now? Is it something that has been going on for weeks, for months? Has there been like a trigger point? Something has changed in your life that would have led to your sleeping pattern becoming erratic? So I think a good history is very important, and I think depending on that we can discuss what management options we have for them.
First point of call should always be to just try speaking to a healthcare professional first and foremost, and as Dr. Callis said, getting a good history or an accurate history is probably the best way forward first.
And I think sleep, we have to remember that it's a natural part of our daily routine, right? So if something's disrupted it, we have to find out exactly what that is and try and rectify it. Any other top tips, guys? Top tips for sleep hygiene, improving sleep, quality of sleep?
One thing I've noticed, I stopped using my phone about 2 hours before going to bed.
And it really does help.
Yeah, it helped me a lot.
Reduce your screen time and stop gaming, or you can read or anything, but just off your screens, you tend to knock out a lot quicker.
I think with the change in weather recently as well, it's really going to impact your sleep as well, so it's probably wise to keep your room as cool as possible. That will really help in the coming seasons.
Cool. So someone said, I work nights sometimes and can't sleep in the day, so I take Nitol. Is this okay? That's one for you, Sam.
So I think in terms of short-term use, yes, but if you're using it excessively, I think that's something that we need to discuss either with your GP or with a clinician, in terms of maybe trying to switch your shifts back. I know with some companies there's a limit in terms of how many night shifts you can work. So it's all about finding that balance. But for the time being, Nitol is okay to use, but not to be used every single day. I'd try to encourage you to use it maybe every other day and try to limit it as much as possible.
So there's no more questions so far, so keep them coming. If anyone has any questions, we'll be getting around to answering them.
Yes, please. Okay, on that note, we'll end it here, but please join us tomorrow where we'll be talking about mental health and work stress, also volunteering and unemployment as well. So see you tomorrow, and please follow us on all our social media platforms.
What's the tag?
HIOS NHS?
At NHS HIOS. You should know that already. Cool. Bye everyone.
Bye.
Bye.